Hello everybody, I am Dr. Senthil Kamalasekaran, Senior Consultant Orthopaedic Surgeon at Chennai Ortho Clinic, and today I am going to talk to you about wrist fractures. This is actually a part of our trauma series which we have been doing from earlier. We have talked about shoulder dislocations, we have talked about stress fractures, and today the topic will be on wrist fractures. Fractures are common. They usually happen following slip and falls and can affect any part of the body. If you fall on your outstretched hand, the chances of a wrist fracture is very high. Apart from this fracture, you can have injuries to your elbow, to your proximal humerus or the shoulder joint, or you can injure your collarbone. So these are the very most common injuries which affect your upper limb when you fall on your outstretched hand. Not any particular age group is affected. It can affect even infants and toddlers who fall, in which case fractures can affect both bones of the forearm, or it can hurt the collarbone. And in children, very small children, nothing needs to be done usually. Usually they heal by themselves very well. If it is a young person, then they can develop wrist fractures, they can have a scaphoid fracture, and they can have a radial neck fracture in which the movements of the elbow are affected. However, the most common injury happens in the elderly age group when they fall and they break their wrist. This fracture is called as a Colles fracture, and this fracture leads to deformity in the wrist. So what do you do when that happens? If it is a very innocuous fracture, something which is very mild, what we normally do is we splint the wrist and we give them some rest. Ice pack it, and usually over a period of time it heals well. We give them also some painkillers. However, if the deformity is a little bit more and you find that your hands are getting swollen, it's always better to x-ray it and show it to your doctor. So once we see these x-rays, we know the deformity, how bad it is. Sometimes these can be treated just with a splint or might be a small plaster. And usually these fractures heal by themselves in 3 to 4 weeks. But if the doctor sees the fracture is displaced, then we normally can correct it and we can treat it with small wires, which we call K wires. Okay, so this is a small procedure which we do under sedation or under a mild anesthetic, and we can get the fracture into good alignment. Very rarely, if the fall is causing a lot of shortening in the wrist bones, there is a lot of displacement of the fracture and it's in multiple fragments, we use plates to fix them. So this is just a small idea about wrist fractures. So when you have a wrist fracture, don't get alarmed. See your doctor. It may not be anything too much and he might just splint it for you and suggest you to rest it, ice it, keep it elevated. However, if the fracture is more worse on x-rays, you might need a small procedure of wiring or plating. I hope this short video gives you some kind of insight into what wrist fractures are. If you like this video, please do like, share and subscribe. Thanks.